What I can say is that in the sectors now, things are much easier because we have the right of access of health whereby you can get things without paying any money. Even now, what I can say for an example, to vaccinate into public sectors, you are not taking out your money out of your pocket. You are doing that for free. So what I can say in the private sector, it's much difficult because I saw it for myself, whereby I did go to the private sector, whereby I did have some symptoms of COVID. So when I was there, and then they said I'm having some symptoms. So I asked them, can they test me for COVID? They said no. If you want to test for COVID into a private sector, it means that you're going to take out money out of your pocket so that we can do the C19 test. And then it's when I went to the public sector. When I get there, it was for free. So for me, public sector is much easier because you are having the right of access of health, whereby you're getting everything for free than in the private sector.
It's free to be tested in the public sector. The only problem with the public sector is that the result takes more than 72 hours. But in the private sector, you get the results within 12 hours, within 24 hours per se. And yet that cost, it's like 850. So people, because it locked down, some of the people are not working, some of the medical aids are not being paid. So most of the people were coming to and are still coming to the public sector because of that, because of the funds.
And I think it's a common problem in our clinics because as I'm working with Unit 10 Clinic, there are huge numbers of people, which makes us as health workers facing difficulties to attend some of them. You'll find, especially in this time of pandemic, you'll find maybe 500 people were inside the clinic for different reasons. Some of them were collecting medication, some of them were sick. You will find maybe hundreds of those 500 will be turned away and they will be asked to come back tomorrow morning. So that's and remember, some of them have asked for day offs at work and all that, but they will be asked to go back home because they are not being helped on that day. And there's a problem of a short staff in clinics. The people who have passed on because of COVID, their posts have not been replaced. So it's a big challenge for us. That's why you'll find CHWs ending up doing things that are not on their scopes. Even the nurses, you'll find them leaving their main core duty, doing something else.
And they queue outside the clinic, and meanwhile they are queuing and they fog outside the clinic, the numbers. Then those who come for their ARVs must stand one side. Those who come for their, that kind of discrimination now, when people can see, it's not everyone that is ready to disclose about your sickness. But now this pandemic thing has made people dignity to flow under, because everyone now knew that Noe is on that line, Noe is taking ARVs, you understand? Go back to the thing that we fought for with UTEC about the discrimination, your dignity. Because when I'm not ready to open up about my sickness, I'm not ready, and it's my right, So this coronavirus and this pandemic make things worse because your dignity, even if I didn't want everyone to know in my street that I'm taking ARVs, now they know because they saw Noe standing in that queue. You understand? That's the worst part of it.
Yeah, I think it has even killed the system that we had been using for so long. I'll make a few examples. With us as CHWs, in my clinic, we have a plan. That's on Monday we're doing this, on Tuesday until Friday. So when the pandemic came, it has stopped all the programs. We have Pilamtwanas, where we visit the kids on Tuesday and give them vitamin A and deworming. Those programs have stopped because now we are all focusing on this pandemic as if there's nothing else, as if there's no HIV, as if there's no TB, as if there's no child that we need to check which the child is growing well. So everything is put on pause and stopped. You know, as you have seen, the vaccination sites have been open. They will want us to go and marshal there. And then our job, the proper job, is on pause.
Our government has really failed us. Why I'm saying that? Our health system before the COVID-19, we had a haphazard. We had a health system that we complain every day, shortage of doctors, stock outs. When our people are sitting at the clinics, it was difficult for our seniors to access even those Pfizer thing. You know, there will be no one standing in front of people and educate, health promoters that says, okay, there was a day that I was mad. There were 4 seniors in our clinic, then they have to turn back because they're supposed to be 6, because they cannot open one chap if the 6 is not there. They have to wait for another 2 to come. And even so, before even there can be an access to e-vaccine, there was shortage of e-vaccine. It was not like CTIC where white people are going, you know. That's why we said the same treatment that those people with medical aids are getting, we need the same treatment in our areas also, because there's time that people must wait at Guguletu Clinic because Guguletu must go and send the car and go ask Hanover Park Clinic for the vaccine because there were no vaccine in our clinic. Meanwhile, we have a problem of doctors want to resign. They already resigned because they wanted to resign those days because of the treatment they are getting, also lack of communication and their levels of doctors. I don't want to talk about that. But what is bothering us is that when the doctors are leaving our areas, at the end of the day, there's a problem to access health care in our areas.
Most of the people were going to hospitals. The hospitals were overloaded. And we know how our public hospitals, especially the administration part, how slow they are. So it may happen that most of the people died because of the administration or because of the level of care in whatever hospital they were in. On how fast was it for them to access the whatever medication or oxygen or whatever what they will need at that time.